Good morning, Dr. Jacob. Welcome to the Regional Committee for Africa. Thank you for coming to this interview today. I understand that the Secretariat has already informed you of the way we will proceed today. We remind candidates that they may address the Regional Committee and answer questions in English, French, or Portuguese. Interpretation is provided. We will start immediately with your oral presentation. You have the floor.
Honorable Chairperson, esteemed ministers, heads of delegation, WHO Director General, Acting Regional Director, WHO Afro, delegates, ladies and gentlemen. A very good morning. Bonjour, bon dia, jambo. At the outset, I wish to express my sincere gratitude to the Regional Committee for considering my candidacy. I'm deeply honored by this opportunity to serve our region in advancing public health. I extend my heartfelt appreciation to Her Excellency, President Dr. Samia Suluhu Hassan, President of the United Republic of Tanzania, for nominating me. Her unwavering trust and confidence in my ability to address the health needs of our region is both humbling and inspiring. I also pay tribute to the late Dr. Faustine Ndugulile, our former regional director-elect, whose tragic, untimely passing has brought us to this election today. We are deeply grateful for the condolences and support received during these challenging times. As introduced, my name is Mohamed Janabi. With deep humility and profound sense of responsibility, I stand before you today, respectively, seek your support to serve as the next regional director. I'm aware of the heavy responsibility this role entails, and I have undertaken this candidacy with the seriousness and dedication it deserves. Over the next 20 minutes, I'll present 4 key areas: background information, my contribution, my vision, and strategic priorities. First, I commend the WHO, the African governments, and their partners for remarkable efforts in advancing health across our continent. These collaborative endeavors have led to the remarkable progress in many critical health indicators. I also extend my deepest gratitude to each one of you for your invaluable contribution and unity, which have culminated in the successful negotiation of the pandemic accord, a milestone we will celebrate with its formal adoption tomorrow. I bring with me over 30 years of dedicated services in the medical profession and its allied fields. My journey began humbly as a young general practitioner, and through years of hard working, commitment, accountability, and leadership, I rose to the esteemed position of Professor of Cardiology and Health Executive. Beyond my clinical practice, I have served as an accounting officer, public health specialist, researcher, scientist, author, academic, and a health diplomat, gaining deep insight into complex global health challenges, including conflict scenarios. Excellencies, I had the honor of serving as a senior advisor on health policy and nutrition to His Excellency Dr. Jakaya Kikwete, former President of Tanzania, from 2005 to 2015, 10 years. In this role, I provided technical support in key areas, including the fight against malaria through ALMA, maternal and child health, nutrition, health financing, and communicable diseases. Recognizing the significance of my contribution, President Samia Suluhu Hassan entrusted me to continue serving in this role upon taking office. Under her leadership, I've played an important role in strengthening emergency responses during the 2023 Marburg outbreak and the control of Mpox and Marburg in 2025. How do resilience, inclusion, and prosperity shape and define my vision? Africa today stands at a pivotal moment. Confronting challenges such as financial uncertainties, climate change, misinformation, antimicrobial resistance, and persistent health threats. These issues demand an immediate, unified, and strategic action. During the course of my duties, I've witnessed firsthand patients being denied access to healthcare due to financial constraints, families parting ways with their possession, their very means of living, just to pay hospital bills. Yet, despite making these heartbreaking sacrifices, many still find themselves trapped in debt and still in poor health conditions. For me, this is a harrowing experience. Out-of-pocket costs have pushed countless families into the depths of poverty, thereby recycling poverty. Honorables, health is a universal human right. I'm committed to ensuring access for all, including people with disabilities, and promoting gender equity. So what evidence demonstrates my capacity to lead transformative change? Honorable, trust is earned through results, and my contribution to health speaks for themselves. I understand the challenges ahead, and I bring a renewed resolve to tackle them. Having visited numerous member states, I have absorbed the urgent need for a fundamental shift in how WHO Afro addresses the unique needs of each country. If elected, I will work closely with governments and collaborators to lead this transformation, creating a more agile, country-focused, and impactful organization. Excellencies, I now turn to my second point, outlining my contribution to health, beginning with initiatives focused on strengthening health systems. My track record spans decades, from co-leading HIV vaccine trials in Tanzania and Mozambique in the early 2000s, to driving public health advocacy that in 2012 inspired President Kikwete to take a public HIV test, encouraging 5 million Tanzanians to get tested that year. In 2021, my efforts also supported President Samia's public COVID-19 vaccination, which played a key role in countering misinformation and boosting vaccine uptake. In 2014, I founded the Jakaya Kikwete Heart Institute and served its inaugural executive director. Within 5 years, through strategic leadership and innovation, we achieved 95% reduction in overseas heart disease referrals. I'll give you an example. In fiscal year 2021-2022 alone, the Institute performed 2,760 surgeries domestically, saving the government approximately $13 million. These savings today have been reallocated, strengthening primary health care and subsidizing services for disadvantaged population, enhancing healthcare accessibility for all. What strategies led us to this success? Our success stemmed from strategic investment in workforce development, infrastructure, domestic health financing, and active engagement with civil society and the private sector. Today, the Institute serves as a regional hub, performing major surgeries from pacemaker insertions to bypass operations. This has attracted patients from across Africa, bolstering our medical tourism, fostering South-to-South cooperation, and generating foreign revenue. In 2022, I assumed leadership of Muhimbili National Hospital, Tanzania's largest healthcare facilities, overseeing 2,400 beds, 4,000 staff, and attending 3,800 patients daily. Our oversight extends to 12,000 satellite facilities, leveraging telemedicine, e-health, and artificial intelligence. To amplify community impact, we initiated a strategic plan to expand community health workforce to 137,000 by year 2030, connecting grassroots population to the formal healthcare system. In 2025, this very year, Muhimbili secured $363 million loan from the Republic of South Korea with very favorable terms. 0.01% interest, 15 years grace periods, and a 25 years repayment. These milestones strengthens diplomatic ties and supports transformation aligned with GPW14. Additionally, early this month of May, Tanzania signed an MOU with United Arab Emirates to construct a specialized infectious diseases hospital in the junction of 6 East and Central African nations, enhancing regional outbreak detection, prevention, and response. If entrusted with the role of regional director, I will apply the same bold visionary leadership, mobilizing sustainable resources and forming partnership beyond traditional donors, ensuring our region receives strategic directions, accountability, and measurable results, including small islands and countries. Next point is on emergency preparedness. In 2015, while serving as a health advisor to President Kikwete, who was appointed by UN Secretary General Ban Ki-moon to a high-level panel following Ebola outbreak, I played a key role in supporting his contribution to the panel's critical discussions. The role took me to Liberia, Equatorial Guinea, and Sierra Leone, gaining invaluable experience in emergency preparedness. The panel's recommendations were instrumental in shaping the WHO approach in managing emergencies that we witness today. Excellencies, I'll move to demographic transition. By year 2035, 60% of our region's population will be youth. Good thing, fueling growth and innovation, but facing risks like substance abuse, unprotected sex, teenager pregnancies, mental health challenges. Simultaneously, the elderly population will double, intensifying healthcare demands. We can address these dual challenges while harnessing transformative potentials of our youth. The next focus is on fostering a transformative mindset. Excellencies, I bring a proven record of transformative leadership and dynamic cross-sector collaboration. Building on WHO's Afro 2015 transformation agenda, I'm committed to advancing reforms that bring really lasting health improvements. My vision includes strengthening our country offices, empowering regional secretariat, and catalyzing resilient health systems that serve our people. As WHO and the UN transformation evolve, Our region must rise to the moment, adapting strategically and aligning reforms with our national aspiration. It is through unity, adaptability, and innovation that we can unlock our full potential and deliver impact. Transformation is not a task of one. It is a shared journey. Collective responsibilities and united efforts from all stakeholders are vital. I believe together we can meet both current and emerging health challenges with resilience and foresight. Excellencies, I will now outline my key priorities. So despite the significant challenges we face today, they present a unique opportunity for us, transforming obstacles into pathways for progress. I'm optimistic and ready to take bold steps to advance my 7 transformative priorities, each equally important and essential to fulfill my vision. My first priority is achieving universal health coverage in alignment with SDGs. With under 5 years to achieve SDGs, our region UHC index is 46, well below the average of 68. Globally today, half of the world population, I'm talking of 4.5 billion people, lack essential services, health services. And over 1 billion face catastrophic health costs. Many of these people reside in our region. I'm committed to ensuring universal health access and reducing financial hardship. My second priority is securing sustainable funding. With over 80% of the WHO budget reliant on voluntary contribution, predominantly earmarked for specific programs, the organizational autonomy and capacity to set and implement priorities are significant constraints. We are all witness to this reality today. To safeguard our region's independence and ensure it can fulfill its mandate, we must advocate for an increased assessed contribution and promote more predictable, flexible, and sustainable investment. I really commend honorable ministers for your 2022 commitment to increase assessed contribution to 50% by 2030, and for reaffirming the Abuja Declaration of 2021. To step up domestic financing, including through blended financing, private-public partnership, and solidarity levies. My third priority is enhancing emergency preparedness to build a resilient health system and foster cross-border collaboration. My fourth priority is advancing maternal and child health as well as nutrition. Africa bears a disproportionate share of global health challenges. 70% of the maternal deaths in our continent, 56% of the death of under 5s, and a stunting rate of 30%, well above the global one of 22. Despite the daunting figures, I believe we can turn the tide. For instance, in Tanzania, under President Samia's leadership, we have achieved 80% reduction in maternal mortality, from 556 to 104 per every 100,000 live births within 7 years. This remarkable progress was recognized with the 2024 Goalkeepers Award, underscoring the transformative power of primary health care and unwavering political will. My fifth priority is tackling communicable diseases, HIV, AIDS, TB, malaria, and non-communicable diseases, and neglected tropical diseases through a One Health approach, a comprehensive strategy that acknowledges the interconnectedness of human, animal, and the environment. My sixth priority is combating antimicrobial resistance, which causes 1.2 million deaths annually. alarming, honorable ministers, 40% of our member states lack antimicrobial surveillance system database. I'm committed to collaborating with you to establish surveillance database, enhance monitoring, promote responsible antibiotic use, and foster cross-sector collaboration. My seventh priority is strengthening local production of diagnostic, therapeutics, and vaccines. By leveraging the pandemic agreement, engaging our diaspora, enhancing health diplomacy, and sharing expertise. I will also promote research development in traditional medicine, aligning with the WHO Traditional Medicine Strategy 2025-2034. Excellencies, as I conclude, I stand before you not merely as a candidate, but as a dedicated partner, unwavering in my commitment to our shared vision of a healthier, stronger region.
Jacob.
With a proven track record in health leadership and clear vision of
Jacob.
I pledge to serve with integrity and determination. I seek your trust and your vote. Thank you very much.
Thank you, Professor Jacob. We'll now continue with questions and answers. I shall ask the Secretariat to take the board, show everyone that it is empty, and pass it around to collect the name tags. Professor Jacob, you may either remain at the podium or take a seat at the main table. I will draw the first name tag. Equatorial Guinea. Equatorial Guinea, you have the floor.
Thank you very much. I'd like to ask the candidate about what would it be the strategy for small countries and islands in terms of getting more attention, in terms of their support of improving the healthcare system as a whole. The question is coming in relation to sometimes there are confluence of interest in terms of where to put the priority of the little resources that we are managing on the continent, and the approach tends to be prioritizing big countries. But sometimes
Equatorial Guinea,
small
you have
countries
one question.
can be the opportunity to say, okay, so what would you do about securing the support from WHO under your leadership? Thank you.
Thank you, Honorable Minister, for a very important question of small islands. And if I can give examples, maybe we are talking about Seychelles, Mauritius, Comoros. You face unique challenges such as climate change, limited healthcare infrastructures, and vulnerability to health emergencies. So, if elected, I will ensure these nations receive a targeted support to address these specific needs. First, I will advocate for tailored strategies like strengthening your health system, improving access to essential medicines. I know small islands depend a lot on imported foods. Unfortunately, these are seasoned foods which come with a lot of salts, increasing NCDs. We'll focus on training and retention of your workers. But the other thing is an innovative method like telemedicine or artificial intelligence, because you can cater with telemedicine, do consultations with neighboring nations while building your workforce and capacity on health or human resources for health. So you have specific needs. We'll make sure that you get preparedness with all the health emergencies, because you are prone to preparedness like any other country. So prepare on surveillance, which has to start now before the emergencies start. We'll assist recognizing the vulnerability to climate change. So I will support development of climate-resistant healthcare infrastructures, build on early warning signs. And lastly, I'll try to prioritize integrating small nations into larger regional health networks, ensuring you have representations during decision-making bodies, because this is where your voice has to be heard and have the data. Thank you.
Thank you, Professor Jacob. We now ask South Africa to ask the question.
Thank you very much, Professor. Do countries need to be rich to implement universal health coverage for their citizens? Why are countries on our continent which have got universal health coverage so few? Thank you very much.
South Africa, just one question. Can you limit your question to one?
It's one question divided into two, Honorable Chair.
I'm sorry, just one. Which one of the questions you want him to answer? Countries rich or
No.
what? Which question?
Okay, I was asking whether countries need to be rich in order to implement universal health coverage, and why in our continent they are so few.
No. Please answer, Professor Jacob.
So which one, the rich one or the? No, Honorable Minister, thank you for the very good question. And does the country have to be rich to have universal health coverage? No, let me maybe start by, I firmly believe that primary health care and universal health coverage, one, they are inseparable, and they are foundation of achieving an equitable, sustainable health system. So my vision of is just all about planning. I'll give you an example. In Tanzania, we've made a significant stride in this area by having we call it Senior Advice on Health Policy, where we expanded our primary health care infrastructure to underdeserved areas. Because one of the challenges when I was moving around, one thing, you have to build on your community health workers, because these are the people who have the trust of the villagers or the underdeserved, They are the people who are communicating with your general population every day. So equipping the frontline workers, like community health workers, and there's other thing which unfortunately is not very prominent in Africa, they call nurse practitioners, because you don't have enough doctors. So if they get training on basic things like immunization, maternal and child health, health education. So these efforts will improve access, but the country has to be rich. My personal experience, I'll say this. One of the things about health insurance, I don't think we've given enough education. You know, I've moved around in most of the member states. You find our members of national health insurance, they are those who are sick. So you have 80% of your members, they are sick people, and only 20% are the healthy ones, and these are the mandatory ones. So I think it's all about health education to our people. They should start getting insurance before they get sick, because it becomes even more expensive for the national insurance, and that's why most of them, they don't succeed. So at the regional level, my priority will be to try to scale up and use some context-sensitive models. And I'll work with you, honorable ministers, so we can discuss. We have got 47 member states with different economies, different population. Talking of Seychelles, 100,000 people. Talking of Nigeria, 220 million people. So each country has to deal specifically
Professor
what are the
Yacob.
challenges and how we can solve them.
Thank you very much. Cameroon, you have the floor. Cameroon, lucky today.
Thank you. Merci.
Thank you, Madam Chair. I have a simple question for the candidate. What can he do to enhance the impact of the regional office in shared initiatives among several countries? We have been working to tackle epidemics and on vaccinations with certain countries, but we can't quite clearly see the impact of the regional office in this. So what is he going to do to enhance its visibility and impact?
Question que j'ai posée, madame.
I just asked the question, madam.
Qu'est-ce que le candidat va faire?
What will he do to enhance the impact of the regional office on shared initiatives among several countries, especially tackling epidemics and on vaccinations?
Can you, Cameroon, repeat the question? Just only the question, not the background.
Thank you, Madam Chair. I wanted to just ask the candidate, what will he do to enhance the impact of the regional office in initiatives that involve several countries, especially when it comes to tackling epidemics and vaccination? Because in our sub-region, especially Chad, DRC, and Niger, we have joint campaigns, but we're not quite seeing the impact of the regional office in these initiatives. What is he going to do to enhance that? Thank you.
Thank you, Honorable Minister, for a very pertinent question about, I think if I got it to you right, is your representations of the countries which you have mentioned. I think my response will be, if elected as a regional director, one of the first things will be to sit down with the members of the Secretariat, the members who I'm going to meet them at Brazzaville, and see, because we are all aware of the restructuring, reorganization, which is happening at the HQ, and I'm sure we have to get prepared with the 6 regions of the WHO. So I will sit down with the members, see how the organogram will look like, discuss openly with everyone, listen to member states. And I think from there, I will be in a better position to see what you are saying, which is very important, the equal distribution of the positions. We are 47 member states. I think regardless of the size, the economy of your country, this is our organ. All of us has to be there. I know we don't have 47 positions, but we'll share the positions according to what I'm going to see on the ground. Maybe it's a little bit too premature for now, but what I promise, there will be equal chance for everyone, depending on your qualifications and your integrity, you'll get a position. Thank you, Madam Chair.
The Gambia.
Thank you very much. We thank Professor for that presentation. Professor, one of the biggest challenges we have as countries is the issue of getting high quality medicines and medical equipment for our nations, and that contributes immensely to the poor health care services delivered. Now, the financial challenges are there. No matter how much resources we mobilize domestically, if these prices keep on skyrocketing, we'll never get what we want. What are your strategies in dealing with pharmaceuticals, equipment manufacturers, to ensure that low-income countries in your region, if you are elected, are able to procure these items at a reasonable price for our people? What strategies will you use? Thank you.
Thank you, Honorable Minister from Gambia, for a very important question. And if I step back, COVID-19 exposed us how vulnerable and the gaps which we saw. But to me also it gave us a footprint, a blueprint, to see the deficiencies we have in diagnostic, therapeutics, and vaccines. Medicines are very expensive, and we have seen now with the financial constraints we are having in the continent, I think we have to come with the innovative measures. And one of them, apart from increasing our domestic financing, how about pooling our resources, including the small islands which we've just discussed, and do this bulk procurement? We can have a better negotiation of prices, whether with Gavi or Global Fund, when we work, because all we need here is to work together. 2, pandemic accord, which we are going to adopt tomorrow, gives us another chance of Africa. Time has come to have our local manufacturing capacity. Now, while we are trying to do that, why don't we start by 2 things? We have regulatory things which have to be looked after, and we have good examples. We look on Ghana, we look on Tanzania, we look on Egypt. I know it's not in our region. At the same time, we have to build on the workforce. Who is going to work in this? Because, okay, the pandemic accord is going to be agreed tomorrow. So I think it's very important, all these things to go in parallel. Build our workforce, the financing, which we have just discussed a little bit, pool procurement, I think we can, I'm very optimistic that it will reduce the prices, we can get the generics, the patents can be discussed, but we have to start now. And the regulatory, if you see all these countries, they've got level 3, Tanzania now is going to level 4 of regulatory, so we can learn from each other. But the ones which we have now, why we have a ground where to start. I think it's just a matter of decisions. And I think this decision was supposed to be made yesterday. Thank you, Honorable Minister.
We now have Central African Republic.
Merci.
Thank you, Madam Chair. Honorable candidate, Professor, you have stressed support to countries and direct work with the countries. Could you describe to me in concrete terms how you are going to manage this in order for the WHO at the country level to change its way of working in order to have a greater impact?
Madam Chair, kindly, I missed the question. The device was not working. I just said how I had the last bit.
Can you kindly repeat Central African Republic?
We have translation is not good. I see that the question that were asked by my Cameroon was not well translated, and mine was very clear. Now I'm going to speak in English.
Can you please ask your question.
Yeah, but this need to be taken into account, Chair. Yeah, the candidate stress the really the need to make WHO work better and in an impactful manner at country level. He would work closely with countries. I would like him to describe how this transformation will happen at country level in a way that he is projecting.
Thank you, Honorable Minister from Central Africa, for a very important question. I think I touched on it, but let me say it again. We have 47 member states with different level of development, different level of economy, different level of challenges. I think among the first things which I'm going to do is to speak with member states. And as I said, our challenges in Africa is not a one-size-fits-all. There are those who they are a little bit farther than the others. So among the things which I'm going to give priority is to try to understand, do a DNA, who has what. I'll give you a very simple example, Honorable Minister. How many member states know that Tanzania does major heart surgeries? How many people know Kenya does kidney transplant? So I think we need to map. We might be having, which I believe we do, a lot of resources among ourselves, and there's no better time for solidarity and working together, not in silos like now. So where I'm going to find deficiencies in Central Africa, maybe in South Africa I can get the expertise. So that exchange of expertise and collaboration, Honorable Minister, will be very important to me. And I think this is how I'm going, because how I'm going to solve or discuss solving with you the problem of Central Africa might be very different from the ones in Burundi. So we'll work together and forge our way forward. Thank you, Honorable Minister, and thank you, Madam Chair.
Thank you, Professor. The time allocated for the interview is now exhausted. I wish to thank Professor Yakub for being with us today. Now, I'd like to ask the Secretariat to accompany you out of the room. While the Secretariat